So post.
Deepthi,
Yes.
we are live, we can start.
Hello, everyone. Joshi Eye Institute, an alternate name of eye care and service to society, over the past 50 years has expanded with a humongous manpower as well as multiple branches at Dharwad, Bagalkot, and Koppal. Patient treatment is not the only aim, patient education is important too. In the current era, where there are multiple myths floating over the internet about the various eye conditions, we thought every patient has a right to know about his eye problem. So, with this aim, we started this program, the iTalk, where our esteemed senior consultants, the doctors, would be sharing about an eye problem, about the various conditions associated with the eye diseases. They would be busting the various myths associated with it. The first of its kind, the first one which we would be hosting today, would be more about glaucoma. The irony is, glaucoma is very common in the society, yet very few people know about this condition. So today, to know more about glaucoma, we have with us Dr. R. Krishna Prasad, who is the head of the Department of Glaucoma at Joshi Eye Institute. He is not just passionate about treating, diagnosing the various eye conditions or the glaucoma and among the children, he is also passionate about the teaching. So with this, I would like to introduce to you our glaucoma department, head of the department, Dr. R. Krishna Prasad. Welcome to the iTalk, sir.
Thank you.
So the first question, before we proceed with the various other aspects of glaucoma, sir, what exactly is glaucoma?
Uh, Dr. Deepthi, I think this is a very important topic that you have started the iTalk with. The glaucoma, or we also call as glaucoma. So people pronounce it both as glaucoma as well as glaucoma. It's a chronic eye disease in which the patient loses vision, especially in the elderly. It's one of the very important causes of blindness in the elderly. It's a chronic eye disease, and probably it's one of the most important, most common cause of blindness across the globe. See, what is very important about glaucoma is the glaucoma causes irreversible blindness. That means whatever vision that you lose in glaucoma cannot be recovered back. When a patient comes with, let us say, 90% loss of vision to an eye specialist or a glaucoma specialist, we cannot do anything to that 90% which has been lost. We can only try to save the remaining 10%. So, this is a very important reason why this glaucoma has to be highlighted. I'm very glad that you are starting this iTalk series with this glaucoma. But paradoxically, this is very paradoxical. Even though it's such a deadly disease in which there is no recovery of the lost vision, hardly anybody knows about this. If you see the knowledge of glaucoma among the general public, it is very, very less. It's a very disturbing fact. Probably many of the patients who come to us with losing a lot of vision, when they are told that they have a glaucoma, they're actually in for a surprise because they don't even know the name of the disease for which they have become the victims. So that is the reason why programs like this, which create an awareness about this disease, are very, very important and pertinent.
So as you stressed, glaucoma is very common in the society. Now,
Yes.
who are the people who are prone to get glaucoma, or what are the causes of glaucoma?
So this is very important because once you know the name glaucoma, you also should know what causes glaucoma. What is the cause? Like so that anybody can be really be aware that whether they can get glaucoma or not, and who are the people who are likely to get glaucoma. Let me tell you a simplistic percentage. Around 5% of population can develop glaucoma. So it is not that everybody gets glaucoma. It's around 5 to 6% can be the aggregate percentage. So you will never know whether you are in that 5 to 6% or in the remaining 94%. So glaucoma is basically caused by increase in the intraocular pressure. We have eye is like a ball, eye is like a, let's say, like football. Okay. So it has some pressure in it. Okay. So when you keep on pumping the air into a football, it starts becoming harder and harder. It becomes like stone. Okay. It becomes so hard that you can't press it. It becomes very hard. So similarly, the pressure inside the eye, okay, what we call as the eye pressure, or in technical terms, we call it as intraocular pressure. That is pressure within the eye. Okay, this pressure actually goes above the normal levels, and this causes the chain of events which finally lead to glaucoma. Okay, so very important to know for a common man that the increase in the eye pressure leads to glaucoma. And basically, what causes this irreversible loss of vision? So that is the second thing that you should know. Glaucoma is a disease of the optic nerve. See, there are many parts that common people come to this, like cornea, lens, cataract, retina, like that. Similarly, there what is called as optic nerve. Optic nerve is the nerve which basically connects the eye to the brain. To tell you in simple terms how the eye works, eye is like a camera. It captures the image from the environment, and the image falls on the retina, the back of the eye. From there, small electrical signals travel along a nerve to the brain, the back of the brain, through which we see. And the vision, we can perceive the vision in the brain. So basically, we see with our brain, eyes just capture the image. So there is a nerve which connects the eye and the brain. This nerve is called as the optic nerve. If, let's say, this is the eyeball model, you can know that this is a nerve which is going from the eye and it goes to the brain. So the nerve gets damaged. So whenever you have a high pressure within the eye, this pressure puts a lot of stress on the optic nerve head. That is the beginning of the optic nerve from the eye. So that gets damaged very, very gradually. So the slow nature of the disease is a very important thing. So to understand in simple terms, what causes glaucoma is basically the increase in the eye pressure causes a gradual damage to the nerve of the eye or the optic nerve, and that results in an irreversible loss of vision.
Thank you, sir. In your first answer, you told us that many people may not be knowing that they are having glaucoma. It may be just incidentally picked up. Now, who are the persons who should suspect that they can have a glaucoma, or what are the symptoms in a patient or a person which tells him that he may have a glaucoma and that he should come early for a checkup? Because as you stressed, the later, the more advanced the disease, the recovery of the vision loss may be difficult. So which patient should come to you? Who are the people who are prone for this disease?
I think this is a very relevant question. See, this is very important. See, basically, who are the people who can develop glaucoma? Okay, in fact, anybody can develop glaucoma, because I told you that small percentage, you will never know to which percentage you belong to. So everybody, it's a hanging sword for everyone. So everybody needs to get screened for glaucoma. So let me just simplify the whole thing. So who are the people who should be screened for glaucoma? The most important risk factor for glaucoma is the age. Okay. So to understand this, you should understand why the eye pressure goes up. So the eye, inside the eye, there is a fluid. There's a water-like fluid called aqueous humor, which is produced within the eye and also gets, secreted or filtered out from the eye itself. That means there is a circulation of this fluid, which is basically for the nourishment of the eye structures. So whenever the aqueous humor is produced within the eyeball, and there is some difficulty in taking it out of the eye, it has to filter through a area in the eye called the angle of the anterior chamber. And if it cannot get through this, if there's a resistance for the exit of this fluid from the eye, then this aqueous humor builds up within the eye and the eye will become very hard. The eye pressure goes up. Okay, so this is important. So with the age, there is a difficulty of the exit of this fluid increases, and age is a very important risk factor. So normally we can have a cutoff, like let's say 35 years. So anybody who is more than 35 years of age can have a small risk of developing glaucoma. And as the age advances, the risk of glaucoma also increases. That means 40, 50, 60, 70, as the age increases, your risk of developing glaucoma. I told you an average aggregate of around 6%.